Hello, class, and welcome to my wonderful topics that is a little bit vague, but it really isn't too bad. You just kind of have to get in the mindset of abstract thinking. Um, and I think from an NCLEX perspective, the questions tend to be in terms of your nursing assessment. So we're going to try to view this through the lens of how it applies to you as a nurse as opposed to the psychiatric undertones of the concepts. No pun intended. So I think this is going to take about an hour. So get comfortable. I wouldn't go too crazy on the note taking the first time around. I think it's important that you take the opportunity to absorb the information. So I'll try to do it in a way that's reasonable. And if you have any questions, feel free to shoot me an email and we'll go from there. So let's get started. I'm doing this as a complete stream, so it's not going to be slide by slide like you're used to with the narrated PowerPoints. This is going to be one recording that I'll likely post on YouTube. I just think it's easier to listen to things that way and easier to engage, so that's kind of why I'm doing it. Well, let's get started. And then my whole thing freezes. Here we go. Learning outcomes. Discuss relationship of self-concept and individual's perception of self. I really don't think I need to read these to you, but I do want you to actually focus on what the learning outcomes are this time around. I do think it's important to understand what's expected of you. I want you to understand what the impact is of self-concept challenges for patients. Diversity, cultural awareness, all that stuff is part of the whole self-concept idea. Health disparities, role of the nurse when caring for clients and families from diverse populations. So as you can see, this kind of has a much wider scope than it might seem, but it does impact care dramatically. So it is very, very important that you take the opportunity to learn how to go about addressing self-concept concerns. So, like I said, we're going to focus on kind of what you as a nurse should look out for, what the expectation is for you, and what you can discuss with your patients as you move forward, because a lot of this is discussion based. But that's enough rambling for me. Let's continue. Required readings. Please do the readings on this. I highly recommend. Do as many practice questions as you can. ATI does not have a ton of self-concept questions, so I'll see what I can conjure up for a practice quiz. If I'm able to find something or enough to justify having an entire quiz for it, that's great. If I can't, I will probably combine it with the nursing professionalism and have one larger quiz for everything. I didn't get a lot of feedback on the YouTube video for F&E, so if you guys like that, let me know and I can try to do it for this too. But this is also much less involved. It's, I think, 1 hour of content each. So just larger concepts and larger ideas are what I want you to focus on when you're studying for this. ATI Fundamentals does have some self-concept stuff that I recommend for supplemental reading. I think in this case, it is in your interest to do the supplemental reading, especially if you don't typically do it. I think this is the kind of stuff where the more perspectives you can have, the better it is for you. So take the opportunity to do the readings. A lot of the stuff won't be covered in the lecture because it's such a broad topic and such a tight window of opportunity for learning. So do your best, do the readings, and do as much practice as you can for these. That's my recommendation for this stuff. All right, so self-concept. And I specifically point out, don't confuse self-concept with self-esteem. And we'll get into this in more detail in a couple later slides, but I want you to really differentiate what self-concept is versus self-esteem, because you will get questions on self-concept and you will get questions on self-esteem, and it's very important that you don't loop them in together, because the way you address them and the way that patients think about them are different. So I really want you to focus on differentiating what the key differences are with self-concept and self-esteem, because they can get really tricky if you're not thinking about it through that lens. And just to give you kind of a general summary, the self-concept is how you view yourself, and self-esteem is how you feel about yourself. And those can vary dramatically based on situation that brought the patient to the hospital, their health issues, their culture, their family, etc. So a lot of what we talk about will be in comparison to self-esteem versus self-concept. I don't want you to get confused, so put in extra effort to make that differentiation. And yeah, it's abstract. It's a psych topic. It's not concrete like fluid electrolytes or wound healing or urinary output and things like that. It is part of your assessment, and when you are doing a head-to-toe assessment in EPIC, for example, you will see self-concept questions, and they are quite subjective. It's very difficult to come up with objective information for self-concept. A lot of it is information you get from your patient. You can get information from their demographics if that's something that you're looking into. But it does kind of have this bubble of vagueness that I think nursing students tend to struggle with, which is why we have a dedicated lecture for it. I do think it's important to talk through this stuff. And as you guys know, I like to say the NCLEX loves asking self-concept questions. So I recommend that while we're going through the lecture, you don't take notes. And the reason why I do that is because it's easier to absorb this information when you're just kind of absorbing it and not trying to dictate it. So listen to this twice. The first time, just focus on like understanding the concepts that I'm talking about and go from there. If you feel like you want to listen again and then take notes, that's what I recommend. But you do you. This is kind of all on you. You know how you learn. But I just think that people struggle with this more than the concrete stuff in some cases. So what is self-concept? So ultimately, like I said before, it's the way a person thinks about themselves and what they know about themselves. So while self-esteem is more like, you know what, I struggle with self-esteem. I don't really like this component of me. I don't like how I feel about myself. That's self-esteem. Self-concept is the way you think about yourself and the way that you view your life. Starts young, evolves over time. It very much evolves with you and your health. To clarify this a little bit more, I like to identify self-concept as like what I am in my life. And I know that's not super easy to wrap your head around. But to give you an example, I view myself as a hardworking nurse. I am the breadwinner for my family. I work to put food on the table. My involvement in working and teaching enforces my idea of my self-concept. My confidence is based on my ability to perform in my work, in school, and things like that. This is all different from self-esteem. Self-esteem, like I said, is more about how I feel about those things. But when you're assessing self-concept, I want you to think of it through the lens of how is my patient in the hospital impacted by them being in the hospital? Are they the primary caregiver in their family? Are they taking care of relatives? Do they have children? Is them being in the hospital limiting their ability to work and make money? Is that causing stress on the family? Is that causing stress on them? As you know, stress can impact healing. And if people are stressed by the fact that they're in the hospital, that can really limit their ability to receive quality care. If they're focused on getting out as soon as possible so that they can go back to work, but they're not fully healed, that's an assessment of self-concept and something that you as a nurse need to be on top of, because it can directly influence the care that you're giving. It can directly influence your patient's outcomes. So that's the first differentiation I really want you to keep in your head is this person who's in the hospital, how is their life impacted and how are they able to cope with that? Changes with life situations, that's exactly what I'm talking about. Influences in identity and relationships. The client that is an athlete and breaks their leg. The client who works in a trade and has to have a leg amputation for a diabetic ulcer that's not healing. How is this life change and how is their identity going to change? Are they going to view themselves differently? Are they going to view themselves in a different lens that impacts their mental health and their physical health? All of this is important and all under the umbrella of self-concept. So I hope that description kind of helps a little bit. I think having concrete examples is a really good way to try to process this information. And so I always say, think back to your human growth and development class. I hated that class. I thought it was just like so abstract compared to the other courses that we were taking for like anatomy and physiology, microbiology, things that seem crucial when you're educating and preparing yourself to go to nursing school. Human growth doesn't always feel like the priority, but it does come back here. You're thinking about your life stages. Think back to Erickson. How is this person able to cope with the change in their life? Is this impacting a milestone for them? It's all very, very crucially important because it will dictate how they receive care and how they go about the healing process. If someone's experiencing a terminal illness or a serious injury, they're going on permanent disability, whether they are a hard worker or not is irrelevant, but it is relevant here. And the reason why is because their ability to cope with a change will impact you as the nurse directly. You need to gear your intervention towards how you can address those concerns with self-concept. And so it does ultimately fall on you as the nurse, and it's your responsibility to assess this information because the doctors aren't going to do it in a way that you can. You're spending more time with these patients and you're really digging into their feelings on the situation. So maintain that lens and consider it as part of your assessment when you're thinking about things like dispo planning, resources for outside the hospital. Do they need food? Do they need social work? All of those things are part of self-concept. So it does capture quite a large umbrella. And so again, how do you see yourself? What is your perception of yourself? Who are you? You're a nursing student. You view yourself through a couple different lenses, depending on your exam performance, depending on your clinical performance. Why are you in nursing school? Are you doing it to improve your career? Why are you doing it to improve your career? What was wrong with your last career? Those are self-concept questions. What are you doing and why are you doing it? How does this impact how you view yourself? Are you trying to make your family proud? Are you trying to make your kids proud? What is your reason for doing the things that you do? Why are you receiving care in the hospital? How is this going to impact your life? What if you had to leave nursing school right now? How would that impact your perception of yourself? What if you don't pass the course? How will that impact you? These are all things that are part of that self-concept umbrella. And so, again, I know this is abstract, but we're going to get through it, I promise. And again, looping back to the self-esteem thing, I always say it's how you feel about yourself, not how you view yourself. They are not interchangeable, and they are both important to nursing care. And I don't want to just read the slides, but we've kind of already talked about this already. So really focus on the difference. How you address someone's self-esteem is different than how you address their self-concept. They might have an alteration in their life that directly influenced their self-concept. Say they have to have a leg amputation, they can't work anymore. How they feel about that and how that impacts their lives are two different things. They might be able to cope very well with it. They might not cope well with it at all. It can impact your self-esteem, can impact your self-concept, all of which, like I said, is your responsibility as the nurse. So take it seriously. Document. Everything you include helps the patient. Get your social work consults if you feel like you need them. Resources, ensuring that your patients are comfortable leaving the hospital and are able to heal is part of what this encapsulates. Rogers' theory of self-concept. Not my favorite. It is very abstract, but this is NCLEX testable, so I do want to go through it with you guys. Take as much of it as you can. It just kind of gives a concrete structure for what you're assessing when you're looking at questions of self-concept. Theory is such a challenging thing, especially in the early stages of nursing school where you just want to gain, like, how do I be a nurse? What tasks do I do? How do I do them? This stuff is more for how that is structured. So it feels unimportant, but I do want you to take it seriously. So number one, in Rogers' theory of self-concept, we're looking at 3 different concepts. The first one is self-image, which is defined as the way an individual views their unique qualities, such as genetic and physical characteristics. That is your image of yourself. That is how you view yourself. That is part of self-concept and part of self-esteem. If I struggle with weight problems and I have body dysmorphia, for example, how I view myself and my physical traits can vary very dramatically over time. And then self-esteem is the evaluative component of self-concept. How do I evaluate my feelings on myself? I'm a patient who is kind of having my leg amputated after working for 30 years and I need to make money. That my self-image is going to change, obviously, because I'm now missing a leg. That is a dramatic self-image change. Self-esteem, I'm missing a leg. Now I look weird. I can't work. I'm useless. I can't provide for my family. What good am I? All of those are part of the self-concept and self-esteem umbrella. There's a lot of overlap. It's very challenging. So really focus on how you view yourself versus how you feel about yourself. It's sometimes hard to differentiate, but it is important. The ideal self, what a person wants to be. I want to be a physically fit guy with 2 legs who can continue doing my job. That is the ideal self. Can you achieve your ideal self when you're missing a leg? Maybe yes, maybe no. But as the nurse, it's your responsibility to help people understand that the ideal self changes over time to account for what limitations you have based on your medical needs and whatnot. So for my patient who lost their leg and they can't work anymore and their ideal self is able to work, their ideal self and their actual current self-image and self-esteem will not line up. And that's what causes tension and decreasing self-esteem and negative feelings towards yourself. As the ideal self starts to get closer and closer to the current state, that's when the person begins to accept what their current situation is and they're able to cope more appropriately with it. It's a challenging thing and it requires a lot of self-reflection and resource allocation and things like that. And as the nurse, you help facilitate that. So it's important to assess based on how the person feels about themselves, but also how they need to adjust and cope to their new life. That involves education, that involves teaching, that involves consultations with different groups, that involves getting resources outside of the hospital. All of this stuff ultimately is controlled by you. You are the advocate for the patient and also for resources that they need so that they can be home and adjust to their new lifestyle. And this is a very dramatic case, but ultimately it all kind of works together. So that's kind of how Rogers' theory of self-concept works. And there's a really good visual here. As you can see, everything kind of swirls together. How you see yourself goes into your self-image, your personality, your appearance, your abilities. Your ideal self is really the expectations for yourself. Am I the breadwinner of my family? Am I trying to provide food for my family? Is my career important to me and I can't do my career anymore? And then self-esteem, societal response. Do people think I'm ugly? Do people think I'm deformed because I'm missing a leg? That's all part of self-esteem and it all wraps into self-concept. This is a really good image. I recommend just kind of understanding how it works. And it's just a visual representation of what we just talked about. Self-concept development. So we start with emotional intelligence. And that, I'm not going to read the slide, but ultimately it's your ability to fully understand and evaluate and manage your emotions. Emotional intelligence varies drastically among people. Some people are very self-aware and able to comprehend how they're feeling, process them appropriately, and make changes based on those feelings. Other people struggle significantly with that. They don't have the same self-awareness, and that impacts their ability to adjust to changes. And just to kind of circle back to self-awareness, it's the ability to see yourself clearly and objectively through reflection and introspection. Do I understand myself? Do I understand what's going on with me? The best example of self-awareness I can give you is the person who's experiencing like a visual hallucination. A person with no self-awareness has no idea that that hallucination is a hallucination. They just think that that person they're seeing in their room is a real person and they're invisible and no one else can see them, and that's their reality. That person has no self-awareness of their situation, whereas a person with a lot of self-awareness or very high self-awareness can say, I am hallucinating. I see someone in the room next to me. I know that person is not real, but I see them. That person has self-awareness and is able to process the information and understand what's going on with it. And then body image is a little bit more obvious. Perceptions, feelings, and thoughts about their body, shape, size, physical attractiveness, very subjective, very difficult thing to address. And again, circle back to your patient who's having their leg removed. How does that impact their body image? They no longer have a leg. They now have a significant deformity. Does their perception of their body image change? I mean, of course it does. But based on your emotional intelligence, your self-awareness, all of that can change your response to any change that you experience when undergoing a healthcare emergency. And so when you are doing your head-to-toe assessment for the first time, you're meeting your patient, doing your admission, you're able to gather a lot of this information through your assessment so you can gear your communication and your interventions towards what that person needs to help adjust to their current situation. So as you go and you're meeting with your patients, you're assessing them, you're getting an idea of their physical well-being, you're also thinking about, are they aware of what's happening? Do they have different changing feelings in their self-concept and their self-esteem? Do we need to address that? Do I need additional resources to address that? Are they emotionally intelligent to understand and cope with their feelings on the situation? Again, that's all on you. No one else is going to do that assessment for you. So you need to fully understand so that you can gear your care towards addressing those problems. The psychiatric and mental health component of this is equally important to the physical component. If this person who's losing their leg thinks they're just going to sit in their wheelchair forever and not move and not work and not engage, that's different than a person who is going to get right back into their life and deal with their disability and make appropriate life changes so they can continue leading the life they want to lead. That's a very different format of care for you to consider when you're going about addressing those problems, performing your assessments, initiating your interventions, performing your evaluations, helping your patient get discharged effectively. So that's the lens I really want you to view this through. Emotional intelligence, self-awareness, self-regulation, motivation, empathy, social skills, all of those kind of wrap into this whole idea of emotional intelligence. Do you understand your emotions? Can you process the fact that you're angry about losing your leg? That you're upset that you're not going to be able to do the same job that you were doing? How are you using those emotions? Are you going to punch the wall? Are you going to use appropriate coping skills? All of that is kind of wrapped into your emotional intelligence. Am I going to scream at the nurse or scream at my wife, scream at the visitor, yell in the hallways, or am I going to take a different approach to all of this mess of emotions I'm dealing with? That's all part of emotional intelligence, and it directly impacts how you behave and how you view yourself. So that's why we cover it. And like I said, it's part of your assessment. It's also part of how you keep yourself safe. If you know your patient has a short fuse and flies off the handle when they get bad news, you're going to prepare yourself for when you have to give bad news to that patient in a different way than someone who is able to cope with those in a different way. So it's for you, it's for them, it's for everyone, and it's part of your assessment. Other factors: self-efficacy, person's perceived ability and aptitude to successfully complete a task. Can I go back to work? I'm losing a leg. Do I have self-efficacy? What can I do? The person who says, I can't do anything now, I have a disability, is different than the person who says, you know what, this is just a minor nuisance, I can do my job, I'm just going to have to get crutches and figure it out. That's self-efficacy in a nutshell. Do they have the aptitude to be able to complete a task? Do they have the perceived ability to move forward with their lives with these new life changes they're dealing with? Culture. How does culture impact how you view your healthcare changes? It's very important to really think about culture in this way because work ethic, perception of illness, perception of life changes, all is impacted by culture. And so when you're doing your cultural diversity assessments, you're thinking about how is culture going to impact care? How is it going to impact them outside of the hospital? It's a very challenging thing to deal with. We obviously can't change people's cultures to fit what we need them to do in the hospital, and especially outside of the hospital. So we're assessing based on, is this person's culture going to impact their ability to heal effectively and cope with their new life change? And finally, role performance. This is an NCLEX favorite. I highly recommend doing practice questions on this. Specific behaviors that a person displays within each role and the perceptions of their ability to successfully fulfill the roles. I would star this one because role performance is significantly impacted by their illness and their perception of their illness. So what happens is think about it through the lens of what is this person's roles in their life? Are they a parent? Are they the breadwinner of their family? Are they the primary good provider for their family? Are they taking care of they're taking care of their parents who are sick? Are they going through this and that? Is them being in the hospital impacting that? Is my friend who's losing a leg and can't work anymore, how is this impacting his ability to perform his role in life? Think about it in terms of what roles they perform in their life, not just their job. Are they a parent? Are they a provider? All of that is part of role performance, and as the nurse, you are addressing that. Sample questions are going to have like therapeutic communication. Client says, I am not going to be able to provide for my family anymore. I lost my leg. I'm just going to be useless now. What is the most appropriate response by the nurse? That's the kind of question I would expect to see in the view of self-concept role performance and self-concept development. And I always like to loop this back into Erikson a little bit. I know I mentioned this before with the human growth and development stuff, but the idea of the milestones that people are hitting, this does come into play here because we're really thinking about when they're in these specific life stages and they're dealing with, say, for example, intimacy versus isolation. And you have your person in their mid-20s who was in a car accident and they lost a leg or something significant and serious like that. Is that going to impact their ability to appropriately hit those milestones? And the answer is it does have a dramatic impact. So that's where this kind of comes back into play here. And it can really have a say in how you go about planning care for these patients. It's a thing that's a little bit difficult in the context of nursing because we're not thinking about psychosocial theory all the time. But in this case, that's kind of what we're dealing with here. You have your pediatric patients, you have your adolescent patients, you have your elderly patients dealing with significant issues. Integrity versus despair is a huge one in this one, as is generativity versus stagnation. You're thinking about your elderly person. They're about to hit retirement age. They're undergoing a serious medical issue that's going to cause them to have to retire early or go on disability. That affects their ability to hit these milestones. And when you dig into the milestones, you think about what not hitting those milestones might cause for those patients. So it is something to think about. And so, I mean, I'm not going to test you on Erikson's milestones, but it is something that's good for life, not necessarily good for NCLEX. It will be good for NCLEX when you're in pediatrics because this comes back into play more seriously there. But for the all intents and purposes of this lecture, I don't want you to like go through and memorize the Erikson theory again, but just keep it in mind. It is important as you kind of go forward. And then just a general slide here. Each developmental stage of human growth and development involves factors that are important to the self-development of healthy, positive self-concept. And that's kind of what I am talking about. Does them being in the hospital and having this significant life change impact their ability to hit certain milestones? Sometimes it does, sometimes it doesn't, but it is something you need to think about. Negative self-concept is a significant result of not hitting certain milestones. And that's kind of what leads to decreased mental health, decreased coping skills, all of that stuff that directly impacts you as the nurse. Important things to think about. Identity formation, complex lifelong process whereby an individual develops an understanding about him or herself within the context of family, cultural, and social norms. Very exciting stuff. Person forms our identity over time. Their family impacts their identity, their culture impacts their identity, their social life impacts their identity. Everything impacts your identity. That's identity formation. Does me losing my leg at 30 years old impact my identity? Of course it does, because now my self-concept has changed, my role performance is impacted, my whole view of myself changes. My identity as a person who is a hardworking person who is on my feet all day and does this and that is directly impacted by me losing my leg. So that's kind of how this very vague slide plays in here. And again, not going to get a massive slide out that apply on identity formation, but it is good to kind of understand the concept. However, identity factors is a slide out that apply question because it is very much a list. And you guys know I love my lists. I would go ahead and star this slide. Identity factors. Career. What do I do with my life? Political views. Am I conservative? Am I Republican? Am I liberal? Am I a Democrat? All that stuff. I don't care what you are, but that does impact your identity. Religious beliefs, relationship, ethnic identity. Does your culture impact your identity? I'll let you go ahead and answer that for yourself. Does my personality impact my identity? If I suddenly lose my ability to hear and can't speak anymore, that impacts my identity. That's a change that you need to assess as a nurse. And so, again, perfect something that apply question here. Just saying, maybe a good idea. Identity stressors. This stuff is obvious. These are NCLEX questions. Body image stressors, self-esteem stressors, role performance stressors. How do you use therapeutic communication to help patients cope with these changes? Role performance changes, self-esteem stressors, body image stressors. Me losing a leg, that impacts all three of these. All three of those are stressors. Am I going to be able to do my job? Am I going to be able to provide for my family? Am I going to be able to not be embarrassed in public for the fact that I don't have a leg? All of that is at play here. And so it's very crucially important that you kind of think about this stuff through that lens. So if you're going to get a question, it's going to be on stuff like this, which is why I'm emphasizing it so dramatically here. Moving on. Nurses play a vital role in planning and implementing a comprehensive, client-centered, holistic plan of care to promote positive self-concept. Again, that's the whole point of this lecture, in a nutshell. Go ahead and put a star on it, not because I'm going to test you on it, but because that's the whole point of me recording this in the first place. I could have just put this in the front and said, enjoy learning about self-concept. But it's in the middle. I don't know. Whatever. Another theory of culture, care, diversity, and universality. This came out in the 50s and kind of sat and stagnated for 30 years, and then people were like, maybe culture is important. And here we are. Assist nurses in planning and providing culturally appropriate nursing care. Culture is huge right now, and it will remain huge forever, as it should. Culture is not only just where you come from, what your ethnicity is, but also what your family life is like, how you cope with your health changes, how you participate in care, who participates in your care, race, religion, social and economic status, disabilities, ages, sexualities, all that stuff. Massively important, tons and tons of NCLEX questions on culture, race, all that stuff. A lot of it is focusing right now on health disparities based on population. You're not expected to know every single health disparity based on population, but it is important for you to start thinking about. They love to ask questions about a nurse is providing community resources for a predominantly Black population on diabetes treatment. It's things that are extremely specific to specific cultural areas. If we know that neighborhoods that are predominantly Black tend to have higher rates of diabetes or heart disease, that's something that is quite literal and something that we need to think about as nurses. And so, theory of culture, care, diversity, and universality, this has massive NCLEX implications for you and is testable. So I really want you to focus on answering answering culture questions and care diversity questions and like universality of care questions. Super duper important. Get your free points. And like I said, culture is everything. It's your language, your communication, your beliefs, social and ethnic groups, all that stuff. Major part of clients' lives, major part of your life as someone who's preparing for the NCLEX and taking nursing exams. Impacts how you care for people and how you discharge people. One of the questions that they love to ask is, you're working with a female client who is Muslim. The patient says, if you're going to provide any education to me, please provide it to my husband. What is the nurse's best approach? Questions like that are part of this culture umbrella of question styles. And it's very, very important that you start focusing on learning this stuff now. NCLEX likes to get specific on cultures. And so if you see culture stuff pop up for education purposes, take advantage of it and through the lens of how it impacts your ability to provide care. If you, like say for example, I, as a male nurse, I've struggled with situations where a patient refuses to have a male staff member because it's part of their culture that a woman cannot receive care from a man. And that's something that, obviously, it's completely acceptable for me to say, like, sure, I'll do my best to find you a female staff member because it's not appropriate for me to do that. I can't necessarily force them to receive care from me. But that's an NCLEX question. A patient is refusing care from a male nurse. What is the best thing the nurse could do? Those are issues that you have to address as a nurse that is extremely uncomfortable a lot of times, but it's something that you do have to do. So understand what you can and cannot do as a nurse, and move forward from there, because this stuff is extremely testable. The NCLEX loves it, and more importantly, I love it. So prepare to answer questions that kind of hit that area of thinking. Cultural awareness, that's kind of more of the same. Being able and willing to investigate and understand differences between perceptions, beliefs, traditions, values within the nurse's own culture, as well as cultures different from their own. You can have your own judgments and feelings towards cultures, but you do not get to exercise them when you are a nurse. Keep it to yourself. You're allowed to feel any way that you want to feel. It's important that you remain open and that you provide equal care to everyone, regardless of what your perceptions and beliefs are. Everyone gets care. Everyone gets the same quality of care. And it's important that you understand that cultures are different from yours, and that as a nurse, it's your responsibility to kind of address them and address specific needs for specific cultures. One of the things that I deal with in psych often is we generally have a rule that you cannot have food brought in from outside. And the reason why we do that is because it helps us protect patients from having like illegal substances brought in, or having drugs brought in, or having an unsafe situation. But some cultures involve using healing foods as a method of healing. And so it's culturally significant that they're able to have culturally relevant foods. And so in those situations, it's important that we use our flexibility to see what we can do as providers to ensure that our patients are receiving the cultural components of care that they need. And so in many situations, we will make exceptions for those patients because it's part of their culture. And if we can perform a little bit of extra care to make sure that they're safe and that they're not at risk for overdosing on illegal drugs, then by all means, we'll do whatever we can to make sure that they have what they need. And so that's cultural awareness in a nutshell. It's not only doing what is appropriate for a culture, but kind of having an understanding of what these cultures kind of involve and what your care should look like for different types of cultures. Cultural diversity. Of course, within and among cultural groups, increased chance of miscommunication. The miscommunication component here is the key. Communication between clients and nurses directly impacted by cultural diversity. If you feel a certain way about something based on your culture and I don't understand that, that can lead to a miscommunication. And it's more than just language barrier. It's like, if I can't comprehend why your religion wants you to do something this specific way, it's kind of on me to adjust and gain understanding so that I can communicate more effectively with you. If someone is doing something that I feel is unsafe, for example, and I feel the need to restrain them, but they're not doing something unsafe, they're just doing something that's part of their religious practice, that's kind of on me, and that's a miscommunication that was exacerbated by my lack of understanding. And so having an understanding of cultural diversity is where this really comes into play. And so think of cultural diversity through that lens when you're answering questions about this. What can I do to limit miscommunication? What can I do to help myself understand these cultures more effectively? The best thing you can do is ask. In many circumstances, I would say, honestly, in most circumstances, if you're confused about something in someone's culture, don't be afraid to just say, hey, can you explain this to me? Just so I can understand and provide better care for you. The majority of people will say, sure, let me explain this to you. And they'll take it as an opportunity to educate you. And that's great. That's what should happen. Is that always the case? Not really. Sometimes that's not a comfortable circumstance for you to be in or for the patient to be in. But best thing you can do is ask and do your research. Cultural competence. Cultural competence training is massive, and it will remain massive throughout your career. We do in-services all the time. We do net learnings all the time on cultural competence. When you do your BSN program, most programs require you to take a cultural competence course. Most hospitals have cultural competence training. Ultimately, it's your ability to understand and research and educate yourself on different cultures so you can provide equal care. That's what cultural competence is in a nutshell, and it's your ability to accept, appreciate, and respect your clients who have cultural differences from you. Not necessarily, here's a textbook of knowledge you need about every culture in the world. That's not what's being asked of you, but at least being able to adjust your care based on cultural differences and respect and appreciate people's cultures and refrain from passing judgment on people's cultures and religions. That's cultural competence in a nutshell. And again, this is extremely important for testing purposes. It's good for NCLEX and it's good for life. EMIC and EDIC knowledge. Different types of knowledge based on cultural needs. EMIC and EDIC is information from within a culture versus from outside of the culture. So ultimately, EMIC is a cultural insider's viewpoint of a culture. So me, or say for example, I am a Muslim male. My EMIC knowledge of Muslim culture is based on me being an insider and having a viewpoint on my own culture. Edit knowledge, on the other hand, is an outsider's viewpoint of a culture. So, as being a non-Muslim white male, my view of the Muslim culture is etic knowledge based on how much I know about that culture, and information that I gain being an outsider. So I will never have emic knowledge of the Muslim culture unless I convert to Islam and enter that culture. Then my knowledge becomes emic knowledge, as I gain more information from inside the culture. But if I remain non-Muslim and I continue gaining knowledge about the Muslim culture, that is etic knowledge. This is an NCLEX question. Go ahead and learn it. I highly recommend. This is free points, and it's so dichotomous that it is a perfect opportunity for me to write an easy question for myself. So I would star this one. It's good to know. Oh, we're almost done. Health equity, defined as attaining the highest level of health for all individuals. Everyone deserves equal care. Health equality and health equity are different. Highest level of care for equity. Health equality is based on opportunities to acquire care. Living in Boston, you're surrounded by hospitals. You got hospitals all over the place. They're in every neighborhood. You got major urban medical centers. You got smaller community hospitals. Healthcare is much easier to find in Boston compared to a poor suburb with only one small community hospital. That is a health equality consideration. Does me being in an affluent neighborhood in Boston give me greater access to healthcare? The answer is yes. I have a greater access to health care in Boston than someone who is in a less resource intensive area where the financial and transportation resources are different. Health equality is a major NCLEX topic. It's important that you understand that different neighborhoods, different cultures, different populations have different access to healthcare, and that is a question of health equality. Most questions you'll see on this are: a community health nurse is preparing resources and planning for allocation based on health equality needs. Which of the following changes would it be appropriate for the nurse to do? You're thinking about not only distribution of resources, but health literacy. Does this population have a higher health literacy need? Is the education level different? Are they able to comprehend health information differently? That's all part of health equality, in addition to the geographic, am I near resources? Do I have community resources? Do I have cost-effective care resources that are relevant to my population? All of that is part of health equality. Like I said, this is good for NCLEX and good for life. This is very testable. Health disparities, different socioeconomic populations, and vulnerable populations. The best example that they like to give that's concrete are, and like I said in previous slides in this lecture, we're thinking about, for example, diabetic needs in predominantly Black neighborhoods. Those are health disparities based on socioeconomic populations. If a predominantly Black neighborhood is more impoverished than other neighborhoods, then those health disparities need to be addressed through population health. And that's the most concrete example, and I think it's the one that is extremely relevant, especially in the Boston area. This is something that is under massive consideration. Vulnerable populations, groups at higher risk. Think about your low-income populations. Think about your mental health populations. People out in the boonies who don't have access to immediate resources need to get med-flighted for everything. That's a vulnerable population. That's something that you need to think about. If your patient is from a vulnerable population, the resources they gain in the hospital are different than someone who has massive ability to access resources outside of the hospital. Involve social work. Do interdisciplinary care. Make sure that a patient has resources they need to exist in their neighborhoods, in their socioeconomic positions, and that they have what they need to be healthy based on those specific needs. Sexual gender identity. And this is, again, very important right now considering the string of abortion changes. We're thinking about sexual care. We're thinking about parenting needs, thinking about sexual orientation and preference. And again, this is both important for life and important for NCLEX because they do test on this, but I really want you to think about things like care specifically for different sexual orientations, transgender care. Does a patient who identifies as female but is biologically male, do they receive different care based on their preferred gender identification versus their biological identification? How do you address that? How do you determine how to speak with a patient? How do you determine specific needs for that patient? All of that plays into cultural competence and also health disparity. Transgender clients tend to have higher behavioral health needs. They tend to have higher suicidality rates. There's a lot of details at play here in terms of how you go about addressing care for patients who have different sexual orientations, sexual preferences, gender needs, things like that. All of that is crucially important, especially when you're entering the field at this time where this stuff is very hot topic right now. There's political needs, political issues associated with it. There's emotional needs associated with it. There's care implications associated with it, all of which play into how you approach a patient. If you're approaching a patient and you're not sure how to address them, what do? If you're caring for a patient and you need to address certain biological needs that might be impacted by their transgender status, how do you go about that? All of that is at play here. And when you go more into cultural competence training, you will address this in more detail. So for now, I just want you to have a general overview of the ideas that are at play, and I want you to really think about how this impacts your care. And again, nothing too crazy here. Multicultural identities, a lovely diorama of things to look at, fun stuff. Ultimately, wrapping this up, listen to your patients. Be kind, be respectful, use correct pronouns. If you say, I don't know what to call this person, that's kind of on you. Don't be an a-hole is my favorite mantra, as you guys know. I'm not going to swear because this is being recorded and will likely be disseminated, so I am not going to swear, but use correct pronouns, show respect to your patients, be empathetic. Even if you don't agree with what their lifestyle choices are, you still need to be respectful and kind. You are still providing care. You cannot discriminate based on your feelings towards specific cultures and lifestyles. Be knowledgeable of sexual growth and development. Understand how health issues and treatments affect sexuality. All this stuff is part of what we consider lifelong learning. You will be educated and re-educated on this all the time when you're working in healthcare. If you do work in healthcare, you probably do this already, but it's important that you continuously do what you can to remain understanding of all these various topics. And then advocate and support individualized care, provide resources, use your interdisciplinary team. If you feel like you need a social worker, get one. Hospitals have social workers. That's something that you can do. Allocate resources. Think about things that you can do that are beyond the scope of nursing that you can get assistance with to ensure that your patients have appropriate resources. All of this is to say that it's on you as the nurse. You assess, you advocate, and you provide resources. So it's your job to kind of maintain this understanding so you can provide the highest quality care. And that's all. Hope you guys enjoyed the recording. I'm going to post it likely on YouTube, and I'll provide a link on Moodle so that you guys can access it. I'll work on posting the practice questions depending on how many I can find. And we'll go from there. So hope you guys have a good day or whatever time you're watching this. And I will see you soon. Bye, guys.